had a flat start and then it's picked up about 30 odd points in the green. But from there, let's talk about Shilpa Medicare as well. They've got a drug boost, or rather drug nod coming in, which of course is going to boost the prospects. So let me welcome on board Vishnukant, the MD, joining in on the show right now. Vishnukant, great to have you today on ET Now. Thanks for your time. This EMA approval that you've got for your new anticoagulant product in Europe, $2.5 billion market size, I assume. When is it that you plan to launch this, and what share of the market are you targeting?
Good morning to you all. And the approval which we got for the Rivaroxaban, you should understand that this Rivaroxaban we have received the approval for the oral dispersible film, which is a differentiated altogether. This is the first time in the world somebody has done this oral form of the Rivaroxaban. And with this EMA approval, we are, targeting for the differentiated formulations in the all market, including the Europe, ROW, and the US market. With this, the market shares and all the revenue will start probably from the 9 to 12 months. And of course, it depends on because this is the first time launch, acceptance of the people and the reimbursement of the pricing is very important in this.
All right, good to know that. But along with that, there are many growth drivers at play. We understand different divisions. You are interested in biologics segment as well. Other segments are also doing well. But if you can help us describe what could be your key growth drivers amongst your various verticals over the next 2 to 3 years?
The Shilpa has initially started with the API, and then we moved to the complex API oncology. In API also, we have invested we are the first to invest into the polymer peptide. People are now talking on the GLP drugs and the peptides. We have invested 5 years ahead. And what has happened in this, in an API, this is normal API will not work. So you have to work onto the API, oncology, that too also CDMO, then again the polymer, peptide, these are the divisions are there. This is again the main growth driver for the Shilpa. The second division we have started was the formulation. The formulation, in that also we started with the complex formulations, and especially that too also focusing onto the oncology especially area, where we have registered our product throughout the world. Globally we have registered our product, and that is going to be and in that also we have made the complex formulation 505B2. Already 2 505B2s in the US has been already genericized, launched already into the market. Another 2 are there into the pipeline. So what we're trying to see in the formulation also, not only the oncology, in that also oncology, can you make the complex formulation? Then the third growth driver was again on the biologics. The biologics, now everybody speaks on the high growth of the biologics, and we have invested 2017-18, and we have put the greenfield projects. Now already the one product has already been commercialized. There also we are working on a CDMO, the biologics onto the ADC, and again on the different the NC licensing. So again, this also will give us a very good growth into the biologics. Then we are there into the a recombinant albumin, which is the first time in the world somebody is doing the study on the recombinant albumin on a therapeutic use. We have done in India. So now our phase 3 is going to start. This also again a unique opportunity for us to start the recombinant albumin. So overall API, formulation, biologics, recombinant albumin, again working on every area segment in the complex formula this one way.
But just to the point that you were making, that the phase 3 of that recombinant human albumin in India and the EU, if you can help us understand, what are the plans to start this? When have this phase 3 already started, and when is the commercial expected?
The phase 3 will complete in the 2026 or 27 early. And then the 27 will probably able to launch into the India market.
That's the timeline. Mr. Bhudata, in terms of your formulation segment, you have received first-in-class approval from NOR UDCA in India. How excited are you about this opportunity? And help us understand with whom you've partnered and when is the launch, if you could just help us with the timeline.
Non-ursodeoxycholic acid, again, unique API we have developed. Then we have developed the formulation. We have done the study on the non-alcoholic fatty liver disease, NAFLD, which is called. This is the first time somebody has done in India. And with this approval, we were the only company in the global to get this approval for the NAFLD for non-ursodeoxycholic acid. In India, now we have already got this CDSO permission to launch this particular product. With the required small approvals from the local authority, probably we should be able to launch next quarter for sure. And we have already partnered this particular product with the 3 biggest companies of the India and the largest companies of the India. And that will give us a footprint in almost all region of the India. And this will, not only this, only the marketing, this will give an unmet need in NAFLD.
Okay, interesting. Also, Vishnukant, wanted to understand what are the other niche launches which have lined up, which you've lined up in your formulation segment?
We have already given into the investor presentation 008, 009, 0010, 11, 12, 13, 14. So these are all the, again, we are working on this, like Tadalafil. Tadalafil film formulation, first time in the Europe, we got the approval. The rotigotine, which is the transdermal patch, we have already filing into the Europe now. The antiemetic, we were doing the antiemetic first time in the world that for the 5 days to 7 days sustained release ER injection, that we are also doing it into the India now. And the entropic alopecia, that especially this is for the hair growth. This also we are putting up that. So we have several into the pipeline, but we are just mentioning of some where we are now having already phase 1 is done and phase 3 is going on, or phase 3 is completion.
Indeed, but now let's talk about your biologics division as well, which is another high growth area for you. What will be the main growth drivers in biosimilars, if we can help us understand that, and believe that you have already invested in some of the new plants in biologics. When do you see the full potential of these plants coming in?
As you know, biologics is a future growth driver for everyone writes it, and then they talks also on that. So, but it's not easy segment. So it's not that something, which can be replicated or can be done very fast. We have invested, as I mentioned earlier, also 2017. And now we have a greenfield project, which has been already commissioned. And from that, we already launched the product. Biologics and biosimilars are the future key growth driver for sure. Out of 10, if you take it, the 6 molecules which are coming into the market has been now the biologics. The highest revenues, which has been like for the pembrolizumab or the nivolumab, you just see that it's in billions of dollars, so 20, 30, 40 billion dollars of the market of each of the molecules is there. And it's not easy to replicate. So this is also very important. But how Shilpa is, doing it on that? We have already we have put up the facility. We have seen the scaling up of this particular product one. Now we are focusing on to the EMA advice for all the molecules which are there in our pipelines. Then working on a CDMO model where we are taking any phase 1, phase 2, phase 3 molecules in our CDMO portfolio. Some of molecules or some of the companies where they are there in the phase 1 or the NCs there, we are partnering with them for taking them, hand-holding them for taking to the phase 1 to phase 2, phase 3, and then licensing it to the all big company. So all various segments are there in this. And we are working on each of these into the biologics so that none is left behind this. And the scaling up or the commercialization and all this definitely is already started. From this year, you can see the quite good growth into the biologics. And over the years, this will definitely grow for sure.
Great to hear that and get in that vision of yours at Shilpa Medicare. Mr. Bhudata, great to have you on the show today. Thank you so much for your